Hi, my name is Vidya Kello.
Hi, I'm Anika Gupta.
I'm Vida Karavi.
And I'm Dr. Ramquist.
So our first question was, what was the difference between dementia and Alzheimer's disease?
That is actually a really good question. And it's something I get asked actually all the time from our patients. Actually, more their families, because what they start seeing are online, what they start Googling for memory impairment. Sometimes it's hard to differentiate, but dementia is actually the umbrella category. So dementia is the name of this degenerative memory issue. And Alzheimer's is just one of the most common types of dementia. So once you think you have somebody who has a dementia process, then you start trying to figure out, well, what type do they have? And so then that kind of spurs us on to figuring out Alzheimer's versus the other ones. So there's a vascular type dementia, there's a dementia with Lewy body, there's a dementia with Parkinson's disease. You can get several others that are much less common, but you'll hear about frontotemporal dementia. And so there's a lot of different types, but like I said, Alzheimer's just being the most common.
Thank you.
Our next question is, how is Alzheimer's developed in a person, and is it just hereditary?
That is another excellent question. So the way that Alzheimer's comes on is actually still being studied. So you would think that after all these years of research and a lot of dedicated time to it, we would have a great answer, and yet we do not. So they do know that Alzheimer's comes from an abnormal protein an abnormal folding of a protein that we all have. So amyloid is a protein that is there, but it can become abnormal and starts to accumulate and become too much for the brain to handle and actually starts to cause damage of the brain. So you'll start getting damage to the neurons of the brain, and unfortunately, those just do not regenerate. And the more you have, the more damage you're going to have. And there seems to be a threshold for which Alzheimer's starts to then be the process of which it causes. So there's also another protein called tau, and that can also accumulate to create these what they call tau tangles. And again, it just looks like a clump of these proteins that then accumulate and cause more damage. So there's been a lot of thought around, is it hereditary, and is there something that I can get looked into to say, hey, do I have a genetic marker to say that my parent has it? Am I going to get it as well? We don't have that yet. They've been trying to find new markers all the time to look to see if there's somebody who might have increased risk. And there are some tests that if you are positive for certain things, that does seem to increase somebody's risk for having Alzheimer's, but there's still no direct correlation with one genetic marker and developing Alzheimer's. They're still working on it. Maybe one day we'll have an answer, but we're not there yet.
Our next question was, what are the most effective ways to prevent Alzheimer's?
So actually, healthy living. It seems like such an easy answer, but at the same time, that's a really hard thing in our society and just around the world. Unfortunately, folks just don't have easy access to all the things to have healthy lifestyles, which is food and environmental factors. And so trying to prevent Alzheimer's is definitely really important because it's trying to be active. Actually, physical activity is really important for brain health, just in general. Cognitive activity. So being in school and learning and educating is one way. Also being in a job, actually just because it stimulates your brain. Folks who aren't able to do any of those things, unfortunately, their brain just isn't stimulated. So it can actually increase their risk for cognitive impairment because they really do find that it's important to keep your brain stimulated. Trying to prevent other medical conditions like high blood pressure and high cholesterol, diabetes, so elevated blood sugars, tobacco use, sleep apnea. a lot of these things unfortunately increase your risk for a dementia process because it's actually causing damage to the brain over time in many cases. So trying to prevent those medical conditions also help to prevent Alzheimer's and other types of dementias. So it's very important for that. Like I said, activity is really important. Good nutrition. They find that there's some probably some association with bad diets, again, because that can increase your risk for other medical conditions. But it's important to try and stay hydrated and get good sleep. They actually consider hearing loss as a concern for increasing your risk for Alzheimer's, which I think is probably more because you're not stimulating your brain because you're not hearing anything. But still, it's important because that can certainly increase memory issues because you're just not hearing something in the first place. But those are all really important factors to try and, one, prevent, but then eliminate as well. So if you do have those medical conditions, trying to help cut those down and control them well so that that too can help with development of dementia processes.
Is there any cure for Alzheimer's, or is there any in the making?
Oh, I wish that there were cures out there. So that is certainly something in research all the time now, and what a lot of folks are trying to pursue, but unfortunately we're just not there. So they do have a couple of medications that came out in the last couple of years, and one was approved, I think maybe 2.5 years or so ago. But that has since fallen out of favor. And now that there's a brand new one actually in the last maybe 4 months, but we're kind of seeing how that is ramping up. Unfortunately, both of those medications are really only to help slow progression down. So far, they've not proven that it's reversing the process. So again, not there yet. We have a couple of medications that have been on the market for a long, long time. But again, even those are only to help slow down progression of dementia, not unfortunately to reverse it. So definitely research is happening, but nothing that has been found yet. So prevention is definitely key.
Our next question is, what are the early symptoms of Alzheimer's and when are they shown?
That's a good question. So a lot of folks will come in to see us for consultation because either they themselves have noticed some memory changes or a family member has noticed memory changes and they've brought their loved one in, or their primary care physician has noticed some changes and they wanted them evaluate because they're trying to get seen early so that, if we do find a cure or something that can help slow it down even, are they a good candidate for that? But very commonly, it's just a change in your ability to remember things. So it is true, though, that it's very common that any one of us under stress or poor sleep, other medical conditions, where it's very easy to lose concentration about what you're doing. So like if you're walking in your house and you've got your keys, and for us ladies, a purse maybe, and you got your bag of groceries in your other hand, and you're thinking about, oh my goodness, I need to get my ice cream in the freezer. Well, you drop your keys, you drop your purse, you put the ice cream in the freezer, and all of a sudden you go back and you're like, well, where did I put my keys? It's very common to misplace things just based on other factors. But when that seems to become more and more frequent, or you're putting things in atypical places, or you are more and more forgetful, and families just like, that's just as different than it used to be. Or even you yourself might notice, this is just different than I used to be. I'm getting more frustrated, or I have a harder time thinking of the right word, or I have a harder time remembering my neighbors that maybe I don't know really well, but I just can't think of them quickly. Again, those are some not just subtle changes that we all can deal with from time to time, but some changes that you're like, nah, this just seems more than typical. That's when people will start noticing a change and usually come and get evaluated. So those are some of the early signs.
What are the different stages of Alzheimer's?
So in research, they actually have multiple stages that they will sometimes utilize. You'll hear like a 6 or 7 stage description of where folks are at with dementia, with Alzheimer's. we as a group, for my practice, we don't use those particular stages. And to my understanding, a lot of groups around here don't utilize those. We do utilize kind of generic stages of mild, moderate, or severe Alzheimer's disease. In more of the mild category, or you can even be preclinical where your symptoms really are just starting to emerge and you just start seeing the difficulty with remembering things and the difficulty with knowing where you placed things. But again, they might be a little bit atypical or strange with where you set something. Remembering not so much the day, but kind of getting days mixed up, or forgetful of what you were about to go do, like an appointment. Again, they just become more and more frequent. More of the moderate category of Alzheimer's, you'll also tend to get some kind of behavioral change and worsening memory. So it becomes more and more apparent that folks have a hard time doing actually their own finances because, again, they just keep forgetting that they actually have to pay their bills. And they start to get confused on how to write a check out or how to actually put the correct information in. Behaviorally, though, too, they might start getting a little bit more irritable, and family might be, wondering, oh, this is just out of character for them. Again, it may not be dramatic changes, but it's definitely apparent, and it can start to be more and more of a problem. It's a pretty long stage of Alzheimer's, and so there's a lot of overlap between the mild to the moderate, and sometimes it's hard to differentiate between the two. But like I said, you start to get a lot more apparent problems in a more, and you'll probably start to have a lot more need for help. So, somebody living alone, we get nervous about that in a stage of moderate Alzheimer's. So we usually start recommending to families, you probably either need to have somebody come and stay with them, or they need to come move in with you, or, skilled nursing facilities where they can just have more assistance and more monitoring for safety. You don't necessarily in the beginning stages start leaving your house and not knowing where you're going, where towards the more progressive stage of Alzheimer's, some people will get confused and they'll leave their house and not know where they're going, and some people are found out wandering. Sometimes they'll go to a neighbor's house looking for their house, but again, that's kind of on a spectrum of more of a moderate Alzheimer's. They usually will need assistance, though, in trying to remember to shower. A lot of folks just don't want to do that, or they don't remember to do that. So they need verbal cues to have their loved ones tell them, well, it's shower day, whatever the case may be. They usually have a hard time with cooking because they don't always remember all the different steps to their recipes. And even following a recipe still becomes challenging. So most of the time, folks are needing help with meals. Still very easy to forget to turn stoves off and sinks off and tubs off. And so you start to notice problems like that. Even like laundry, you might be putting red clothes in a white clothes wash. And, somebody who had been doing their laundry for a lot of years would have known not to put those two things together. But somebody with Alzheimer's, they don't see it that way any longer. They don't realize that they need to separate out clothing. So they just might get stuff all together. So again, they definitely need more assistance in a moderate, but again, there is a spectrum of severity. Then you get to a severe Alzheimer's, and there's a lot of assistance that's needed. Not only verbal cues, but people might actually have to help feed somebody or actually take them to the restroom. Actually going to all of their doctor's appointments because they actually can't understand what people are telling them any longer. So there's a lot more assistance that's needed, and to the point where folks cannot actually do a lot on their own. Because Alzheimer's is a neurodegenerative process, the brain is slowly dying away. And so your ability to function becomes less and less. And so even towards the end of a moderate stage of Alzheimer's and into the severe stage, you're still going to need help with even things like dressing and bathing and like actually help with those things. And so, but certainly in the severe category, that is something you're going to need help with basically on a daily basis. You can't be left alone. You basically think of a young child who doesn't know better. that is basically what the brain is doing. It's reverting back to, because it's dying away, for lack of a better term, where you just don't know what you're doing. And unfortunately, so if you think about it like a small child, you have to help a small child do things. And that's ultimately what, unfortunately, you have to do in these severe stages.
Our next question is, what is the life expectancy after being diagnosed with Alzheimer's?
So that is a good question. Unfortunately, it's going to be very variable because so many people come in to see us or their family doctor or get evaluated by some other means at various stages of their disease process. And so I use stages in that way, kind of generically. Some people don't think they have, a lot of folks with Alzheimer's, they won't think they have a problem. So, but family members have a variety of opinions about how their loved one is doing. And so sometimes they'll just brush it off and be like, no, they're fine. So they actually might be more progressed in their disease process by the time we see them. Well, if that's the case, by the time they're actually formally diagnosed, they may only have a shorter number of years as compared to somebody who came and saw us really early. So, but on average, it's kind of cited to be somewhere around maybe 4 to 8 years of a life expectancy after diagnosis. But again, if somebody comes and sees us really early, you could go 15, 20 years where, again, living a healthy lifestyle and you've got a lot of support around you. Some folks can do really quite well, even in the struggle of having the disease.
Our next question was, are the rates of people who are diagnosed with Alzheimer's disease increasing or decreasing?
So it looks like, interestingly enough, that it's increasing. Even though there's a push in our society for being healthier, there's still a lot of decline in terms of health problems, and dementia is one of them. So some of it might be that we're talking about it more and more is known about it. And so maybe more and more people will be diagnosed early. And so, but they, again, range a little bit of a spectrum in terms of what it's being projected, but probably at least 3 times as many people are going to be diagnosed in the next 20, 40 years as compared to right now.
Are there health issues in the body after being diagnosed apart from the mental aspects?
Yeah, that's another good question because it's something we don't always talk about. It's something you don't always hear about in the news and, even movies that are related to folks with dementia or Alzheimer's. Not only do you get the memory decline and the inability to remember their appointments and how to do things, or when they're supposed to do things, or where you're supposed to put things, or how to cook, or you do, because it's a neurodegenerative process, kind of like I alluded to with the stages of Alzheimer's, you do get physical decline as well, and in most aspects. So you tend to get urinary incontinence, so you just can't hold your bladder very well, even bowel incontinence. So unfortunately, it might be that you have accidents a lot more frequent. And again, that progresses as the disease progresses. Some of that is because you just don't understand the urge that you have to go. And so, the patient themselves don't really notice that any longer, but that does become a problem. Again, as the disease progresses more in the severe stage, your balance is worse, you tend to be weaker, and so your overall bodily function actually does decline. So usually folks who end up passing away, it's some kind of illness that they succumb to. But again, their body becomes weak enough where they can't fight it off any longer.
Yeah, that's all the questions we had today. So,
okay. Well, I'm really impressed that you guys are trying to make awareness of this. It's unfortunately a big problem. So it's something that, again, prevention is a really big deal for it. And I don't think that that's something that's talked about enough. So to try and get awareness out there actually does make a difference. So, but I appreciate you guys having me. I hope it's a wonderful rest of your experiment with this. This is great.
thank you.
So yeah, absolutely. It's very nice to meet all of you guys.
You too.